The Canadian Medical Association is almost as old as Canada itself. So, for anyone passionate about improving healthcare, the CMA is a household name. I've been involved in Indigenous health advocacy for years, and I'd seen the CMA in action many, many times. I wasn't actively looking for a CMA leadership position, but a former CMA board member kept encouraging me to apply. They helped me to see that sometimes you have to sit around the tables where decisions are being made in order to have the impact that you want. And that's really what ended up leading me to serve on the CMA board. In many ways, the CMA helps to set the tone of where Canadian healthcare is going. And that means board directors shape the future direction of Canadian healthcare. Together, board directors set the priorities that guide what CMA executive teams will operationalize, looking back at what's been accomplished over the last year and to the future of what's around the corner. How success is defined and measured and what issues get prioritized, that's all a part of what the board does. Ultimately, being a board director is about making sure the CMA is focusing on the right things and moving healthcare forward in ways that matter. In clinical practice, the demands are endless. Patients need more than the health system can give, and physicians end up getting stretched physically, emotionally, spiritually, and relationally. It's hard to see past that some days, and I think that's a major barrier why people don't consider leadership positions. Done in the right way, however, leadership can make as big of an impact as the impact you're making at the bedside. During my time on the board, we brought forward reconciliation in a significant way, including shaping the CMA's apology to Indigenous people. We also brought issues like pan-Canadian licensure into mainstream conversations and showed the average Canadian how physician mobility could address gaps in care. We helped move forward the largest federal investment in healthcare since 2004. And all that happened because of the leadership and support of board directors. Medicine is full of people who want to make a difference, but the issues we notice are shaped by the lives that we've lived. If certain problems don't get solved, it's often because the people around decision-making tables don't experience them as urgently as others do, or don't notice them at all. That's why diversity in CMA leadership ends up being so essential. Having First Nations, Inuit, and Métis voices on the board is especially important now, 1 year after the CMA's apology to Indigenous peoples. Representation helps ensure that reconciliation is not just a moment in time, but ends up becoming a long-term commitment. Indigenous physicians can bring perspectives grounded in their own lived experience and also their experiences directly with communities, understanding the problems that they're facing, as well as the solutions that could actually work. Board leadership shapes the priorities, strategies, and investments that determine whether the CMA's commitments to Indigenous health end up being realized. As a board director, you can help ensure that reconciliation stays central to the work of the CMA through partnerships, policy, advocacy, relationship building, and creation of accountability structures. It's one of the most powerful ways to make sure the organization's values translate into real-world outcomes. Fitting a certain mold used to be the path to leadership roles in organizations like the CMA. Today, however, the path to leadership has been reshaped to focus on people who understand how to connect, who show up for their communities, and who are ready to make a real difference. If you're the person people turn to for advice, if you're the one who helps hold things together as they're falling apart, if you have a deep desire to learn, grow, and help fix what's really wrong with Canadian healthcare, you have the qualifications to be a part of the CMA board. There's never been a greater need for people who want to make an impact, and there's never been a better time to step up and be a part of that needed change.